Do you suffer from headaches chronically or just on and off, and it's really hampering your ability to perform and concentrate at work or life? I want to really discuss a couple types of headaches that we see in the office a lot. And those are cervicogenic headaches that I see with two different types of pain patterns that are very common with the general population, and I see them just impacting their life in many ways. They can't concentrate, they're stressed out, it makes them frustrated and short-fused, and it can be a very painful type of condition that they have. And the cervicogenic headache is just a big fancy word for coming from the neck, whether it's the muscles or the joints or the ligaments of the area there. And so I want to go over that with you, okay? I'm Dr. Kevin Christie at HealthFit Chiropractic and Sports Medicine, and we see headaches a lot in our office. And commonly, what's happening here, I'm going to take this spine, and you'll see the base of the skull. Two pain patterns that are very common is we'll get people with pain that they feel like it's behind the eye, maybe one eye or both, and that's their description that they give. Or it's at the base of the skull here. So this is the base of a skull facing that way. And a lot of times you'll see these little muscles here, they get very tense. We end up with some poor posture or forward head carriage, and the head weighs, 10 to 12 pounds, give or take. And all these muscles back here are holding on for dear life to try to hold that head up, and they get very tight and tense. And when we palpate these muscles and try to figure out what's causing these headaches, a lot of times these will be really tight. What we also check out is the joints, right? You've got a joint that goes from the cervical spine, the neck, to the base of the skull and then all the way down. And so we check to see if there's any restrictions there, and we may apply a chiropractic manipulation to that area to help get some movement and some relief. But with the muscle component of it, we do something called active release technique, which is just a muscle therapy, and we're certified in that. And we can really get in there and really loosen up those deep occipital muscles, get rid of some of the trigger points, and try to normalize that area, and that'll decrease the strain being placed. And that pain that you feel behind the eye a lot of times is a referred pain from back here, or the pain back here is just obviously localized. And so those techniques, along with some corrective stretching and exercises, can really help you get rid of the headaches and actually prevent them. You don't want to have to take pain medications constantly for these headaches, and this is a really good alternative for you. And we'll, develop a very short, concise treatment plan, a couple times a week for a few weeks, keep an open line of communication on how you're doing, and then from there we can hopefully resolve this condition for you, so you don't have to live this life of kind of the yo-yo effect of having headaches and not having headaches, and it affecting your life in various ways. And so getting a hold of this can really help just enjoy the pain-free quality of life that you deserve at work, at home, with your kids, or even just during your daily routine. So check us out, HealthFit Chiropractic. We'd love to help assess your headaches, do a complete neurological and muscular joint restriction evaluation, and then deliver treatment on the first day of your appointment.